Now, Kiki will give us an update on mental health assessment for young children, otherwise known as MHAYC.
Hey everybody, my name is Kiki Fabian. I work on infant and early childhood mental health programs at HCA. I'm first off going to start with a little bit of background on how do we think about developmentally appropriate mental health services for young kids and their families. When kids are at this age group, which we usually think about birth until they turn 6, they're in a really unique developmental and relational space. And when working to support their mental health providers might need additional time to understand the strengths and concerns of the child and the family in a bunch of different areas, their physical health, their developmental milestones, what's going on in their social lives, what's happening in the context of relationships, and finally in their behaviors and their emotions. Providers might also need additional support for meeting families in comfortable settings, like at their home, their preschool, Boys and Girls Club, so that they can see families where they're used to being together and they can really observe the child's behaviors in real time. And lastly, providers might need special language for understanding themselves and explaining to parents what mental health even looks like in early life. So we might have some preconceptions about what depression looks like for an adult, but what does depression look like for a 3-year-old? That can take some additional time for folks to think through and to understand. So we can move to the next slide. So similar to what Tina shared, this legislation came out of the work of the Children and Youth Behavioral Health Work Group. It was passed in 2021, called House Bill 1325. And it creates some new policies for how the mental health assessment or the intake evaluation or the diagnostic evaluation happens for really young kids enrolled in Apple Health. 2 of these pieces are around reimbursement policies, so making sure that providers are paid to provide the services that really are developmentally appropriate. So allowing providers to get paid for doing assessments that might take multiple sessions. You might need more than one meeting with the family to really understand what's going on. It also allows reimbursement for when providers are traveling to home or community settings. So they're getting mileage rates for that time that they're spending in the car driving out. And lastly, there's support to use what's called the DC 0 to 5, which is very similar to the DSM, but specifically designed for young children. So it includes additional disorders and diagnoses that you wouldn't see in older children, youth, or adults, and also developmentally appropriate criteria for what those disorders look like in young kids. So we can go to the next slide. So since this passed in July, or went into effect July 2021, HCA has been busy kind of putting all the different resources and supports in place to help this happen for folks. So all of the reimbursement policies went into effect January 2022. And since then, we've had a bunch of different billing guidance and webinars that are available on our website. We have a web page for this effort, which Jennifer said we abbreviate to call MHAYC, but stands for Mental Health Assessment for Young Children. And if you head over to that webpage, you can find billing guidance, webinars, resources to help you understand how to access those reimbursements. There's also some additional tools for best practice. One key one is the DC 0 to 5 crosswalk. So that helps providers connect a DC 0 to 5 diagnosis to what's the appropriate ICD-10 code that they put on their claim that's required for billing purposes. We're also really excited to offer free trainings to providers and to allied professionals who work with young children and families in how to use the DC 0 to 5. This is done through a project we call the Infant Early Childhood Mental Health Workforce Collaborative. Ooh, that's a mouthful. And they're now starting to provide communities of practice for folks who've gone through the DC 0 to 5 training, as well as other trainings on assessment and diagnosis that help support providers in this work. They also have a webpage where you can find out about trainings, resources, and sign up to be on their email list. We'll go ahead and put the links to those in the chat. And if you have any questions, our contact information and other resources are available at the end of the slide deck. And that's all I've got for today. Thanks, everybody.
Thank you.